Dear students, welcome back. In the previous session, we have finished the valves of the heart. Now, we are going to see the arteries supplying the heart. The heart is supplied by two coronary arteries which are arising from the ascending aorta. Both arteries run in the coronary sulcus. Here, these two arteries which are arising from the ascending aorta mainly arises from the antiaortic sinuses. So, as we know that there are three semilunar walls which is present inside the aorta. Above these walls, it is having the aorta is having some dilatation called as sinuses. And this sinuses is divided into three parts. One is the anterior and the posterior. The posterior is further divided into two. One is right posterior and left posterior. These are posterior and this one is anterior. Okay, so these are the dilatations which are present in the aortic sinus. So, the right coronary artery, coming to the right coronary artery, this is the right coronary artery and this one is the left coronary artery. The right coronary artery is smaller than the left coronary artery. It arises from the anterior aortic sinus. Now coming to the course of this right coronary artery, it passes forwards and to the right, which emerge onto the surface of the heart between the root of the pulmonary trunk and the right auricle. Here we'll have the right auricle and this is the pulmonary trunk. In between these two structures, this artery passes forwards and towards the right by emerging on the surface of the heart. It then runs downwards in the coronary sulcus, that is right anterior coronary sulcus, up to the junction of the right border and the inferior border of the heart. So there it winds round the inferior border to reach the diaphragmatic surface. This is the diaphragmatic surface, and after reaching the diaphragmatic surface, this right coronary artery moves backwards, runs backwards and to the left, and finally it reaches to the right posterior, posterior interventricular groove by passing the right posterior coronary sulcus. It is passing in right coronary, posterior coronary sulcus. So, this is the course of the right coronary artery, and on the diaphragmatic surface, it finally, after reaching the posterior interventricular groove, it finally terminates as by anastomosing with the left coronary artery. So, this is the course of the right coronary artery. Along this course, it gives many branches. Some branches are large branches and some are small branches. Here, at the origin of this right coronary artery, it gives a right conus artery, so which supplies to the root of the infundibulum, and also the same kind of left conus artery which is also rising from the left coronary artery, and these two unite to form as a necklace around this infundibulum, root of the pulmonary trunk. So this right conus artery, if it arises directly from the aortic sinus, sometimes it occurs, then it is called as third coronary artery. So normally it arises from the right coronary artery. So after that it gives some branches to atrium, that is the atrial branches, and some ventricular branches. Okay, and it gives, on this course it gives a large branch called the marginal branch. After coming to the reaching the diaphragmatic surface, when it reaches to the posterior interventricular groove, it gives a branch called as posterior interventricular branch. Okay, these posterior interventricular branch and the marginal branch are the large branches, and the remaining branches are small branches. And this right coronary artery also gives branches to the conducting system, that is the right coronary artery supplies 60% of this SA node. Only 40% cases are supplied by the left coronary artery. And if you can see this posterior interventricular branch, so here you can see some light reddish part we can see here. This is the posterior, this is the posterior interventricular branch, and this one is the coronary branch, right coronary artery, which ends up as the posterior interventricular. This interventricular branch gives another branch to the AV node. So it gives branch to the conducting system which is present here is the AV node. So these are the branches which are arising from the right coronary artery. So it supplies right atrium, and it mainly supplies the right ventricle, except some part which is adjacent to the posterior interventricular septum. That means a small part of the left ventricle is also associated with the posterior interventricular groove. For that reason, it is also supplied some part, very small part of the left ventricle, which is present adjoining to the posterior interventricular groove. And it is also supplying the posterior part of the interventricular septum. Okay, and it supplies whole conducting system of the heart. So whole conducting system of the heart, and that means it is supplying SA node, AV node, and also the AV bundle. In the AV bundle, it supplies the right branch of AV bundle, and left branch of AV bundle is not supplied by the right coronary artery. That means majority of the conducting system are supplied by the right coronary artery. So these are the course, branches and areas of distribution of the right coronary artery. Okay, so after that we are going to see the left coronary artery. So the left coronary artery is larger than the right coronary artery. The left coronary artery is larger than the right coronary artery. It arises from the left posterior aortic sinus. It arises from the left posterior aortic sinus. Here we can see this one is the left posterior side. So this is the left posterior aortic sinus. So this is the part where the left coronary artery is arising. Now we will see the course of this left coronary artery. This artery first runs forward and towards the left and emerges between the pulmonary trunk and the left auricle. Here it gives an anterior branch called as anterior interventricular branch, which runs downwards in the anterior interventricular groove. After giving this branch, the further continuation of the coronary artery is sometimes called as circumflex artery, and this runs to the left, and this runs to the left anterior coronary sulcus. It winds round the left border of the heart. Here you can see the left border of the heart here. Yes, it winds around the left border of the heart and continues into the left posterior coronary sulcus up to the posterior interventricular groove. Up to the posterior ventricular groove, this runs in this coronary sulcus, left posterior coronary sulcus, where it terminates by anastomosing with the right coronary artery. This is the course of the left coronary artery. The left coronary artery is larger than the right coronary artery. It arises from the left posterior aortic sinus, and the artery runs forward and to the left and emerges between the pulmonary trunk and the left auricle. Here it gives an anterior interventricular branch which runs downwards in the anterior interventricular groove. The further continuation of the coronary artery is called as circumflex artery. After giving of the anterior interventricular branch, the artery runs to the left in the left anterior coronary sulcus, where it winds round the left border of the heart and continues in the left posterior coronary sulcus, and near the posterior interventricular groove it terminates by anastomosing with the right coronary artery. This is the course. And coming to the branches, it gives a large branch called as anterior interventricular branch, and also a branch called as a branch to the diaphragmatic surface of the left ventricle, that is the diagonal branch. And at this point of left border of this circumflex artery, it also gives left marginal artery, and it gives small branches to the left atrium and some pulmonary and terminal branches. So these, and also the left ventricle. So the left ventricle also supplied by this artery. Okay, so the branch which is giving to the pulmonary, so we already know that it is called as left conus artery there. Okay, which anastomoses with right conus artery, forming a necklace around the pulmonary trunk, called that structure as annulus of Visusen's, and it supplies to the left atrium mainly and also ventricles. Here the greater part of the left ventricle, except the area adjoining the posterior interventricular groove, and a small part of the right ventricle also supplied, which is adjacent to the anterior interventricular groove. That means here the surfaces which are adjoining, that means din pakkana unnavannamata. So adjacent to this groove, some part of the right ventricle is also supplied by this artery. Normally the majority of the right ventricle is supplied by right coronary artery, isn't it? So but some part which is adjoining to this anterior interventricular branch also supplying a small part to the right ventricle. And the posterior aspect also the same thing, greater part of the left ventricle except the area adjoining the posterior interventricular groove. And also a small part we have seen already, and also the anterior part of the interventricular septum, anterior part of the interventricular septum. And in coming to the conducting system of the heart, it supplies the left branch of the AV bundle. So these are all the arteries supplying the heart. Coming to the collateral circulation, the cardiac anastomosis, the two coronary arteries anastomose with each other in the myocardium. And coming to the extra cardiac anastomosis, the coronary arteries anastomose with the vasa vasorum of the pulmonary arteries and the internal thoracic arteries, vasa vasorum of the aorta, the bronchial arteries and the phrenic arteries. The internal thoracic arteries, the bronchial arteries and the phrenic arteries anastomose through the pericardium. These channels may open up in emergencies when both coronary arteries are obstructed. Okay, these are all the anastomosis of the arteries of the heart. Now if you see the transverse section at this level, that is the ventricular level, how this ventricles are supplied by these two arteries. Here now we can see here, and we can also see in the transverse section once the atria is removed here. So we can see this aortic sinus, which is, this one is anterior aspect and this one is posterior aspect. So this aortic sinus is divided into anterior, left posterior and right posterior. The right coronary artery is arising from the anterior aortic sinuses. Okay, and left coronary artery is arising from left posterior aortic sinus. Both run in the coronary sulcus itself. Okay, at the posterior interventricular groove, it gives posterior interventricular branch. At the anterior interventricular groove, it gives anterior interventricular branch by the left coronary artery. Posterior interventricular branch is given by the right coronary artery. Okay, so these are the major branches, and you can see the marginal branch of the right coronary artery here. And if you see the transverse section through the ventricles, how the two coronary arteries are supplying here. This one is the anterior and this is the posterior, and right side and left side. Okay, so this one, the circular one is called as left ventricle and this one is a right ventricle, and this is the septa which is separating the right ventricle from the left ventricle. So here the lightened part is supplied by the right coronary artery. So the majority of the right ventricle is supplied by the right coronary artery, and the posterior interventricular groove, that is the adjoining surface of this posterior interventricular groove, some part of the left ventricle is supplied by the right coronary artery, and right coronary artery supplies 1/3 of the interventricular septum, that is the posterior part. Posterior 1/3 of the interventricular septum are supplied by the right coronary artery. Okay, and this reddened part is supplied by the left coronary artery. That means majority of the left ventricle are supplied by the left coronary artery, and a part adjoining to the anterior interventricular groove. That means a small part of the right ventricle are supplied by the left coronary artery, and 2/3 of the interventricular septum is supplied by the left coronary artery. So this is the area supplied by the two coronary arteries through transverse section, which was done through the ventricles.